Bismillah ar-Rahman ar-Rahim, my dear vascular colleague. The talk I'm going to speak about today is the role of artificial intelligence in optimizing lymphedema care. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon. I would like to give my intended learning objective of this presentation that we need to optimize lymphedema care. It's definitely clinical demand. How artificial intelligence can help us. I will give some example of AI programming, simple one, and then advanced AI programming to help lymphedema center. How can AI improve the diagnosis and the monitoring of lymphedema patient? Here, I have given 3 examples with 3 videos. Each video explain one of the procedure that we need for lymphedema care that is needed by artificial intelligence. Number 1, we need to do a good measurement of the lymph, and this can be done by artificial intelligence. You can see the machine that will give exact measurement to your lower lymph. Not every 4 centimeter do measurement, but this will give a 3D dimension of the lymphedema care. Not only this, but you can do bioimpedance, which will tell you how much of water and how much is fat is in your leg. And this is again done automatically by artificial intelligence. You just stand up on this machine. It will give you a report, and this report will have all the artificial intelligence information about how much fat and how much water. Also, imaging needs artificial intelligence. This is imaging of lymphatics after patient with radical mastectomy, where you can see all the lymphatics stops in the axilla. Nothing passes this. All this is a simple use of artificial intelligence. Now let us discuss advanced use of artificial intelligence. One of the great advantages of artificial intelligence is the development of GPT program, which is now 4.0 by the great AI machines. Now, there is a beautiful advantage that you can have a custom GPT, which means a GPT that can only directed toward a focus to treat of one disease. So this is a paper published in May 2024. And the article is called Integrated AI in Lipedema Management, Assessing the Efficacy of GPT-4 as a Consultant Assistant. So here you train an AI model to be an assistant to a consultant to treat lipedema care. They called this program LipoGPT. You can easily do that without even coding experience. By opening custom GPT, you have to be a member to pay the monthly fees for GPT Prime, and then you have the facility of making a custom GPT. So this is a GPT that is custom to treat lipedema, and this is the logo that they have selected for this program. And you use what is called the development of GPT programming by prompting technology. So here you have a program, and here you can have world expert, and they did present 6 cases to both of them, either the AI or world expert. AI use custom GPT called LipoGPT, which is by company OpenAI. They use Azure as a store of their knowledge, and they use prompting technology. And world experience have the vast advantage of having 40 years experience of dealing with these patients, like my dear colleague, Professor Yasser. And this is the logo for GPT. So let us see what these 2 will do to 6 patients with lipedema. The prompting technology is a technology that you can really dedicate the LipoGPT to have a certain orders or a certain program. So you ask GPT with this prompting technology. You tell first, you communicate with the patient. He will follow that order because now GPT 4.0 can have voice and image recognition. So he is like a human. And you tell him select language, makes the patient feel comfortable, temperature 0.7. What this means, that means speak kindly and softly to the patient. And you can judge this between 1 to 10. They call it temperature for the prompting technology because now there is a job called prompting engineer. So here, the AI can never get angry, will never get a bad reply, will never get fed up. Always speak nicely to the patient. Greet the patient politely, explain the procedures that you're going to examine him. All this is called the prompt technology. I wouldn't go on because this is about 3 pages. You tell it exactly what to do. And this is the prompt technology. And they follow something which is called a chain of thoughts. A chain of thoughts is a new way of AI engineering, which means you build up a step-by-step thinking. So you tell the patient, take the history, get all the previous investigation, all previous procedure, get all patient data, start taking history, start doing examination, and as I said, always be nice and comfortable. Temperature of the conversation is 0.7, so you could never be angry. Nowadays, in China, there is a totally AI hospital, artificial intelligence hospital, which have 14 artificial intelligence doctors, like this one, like LipoGPT. And it has certified AI nurses. It can treat patient 24/7. It doesn't need vacation, doesn't get tired, and is medically legally proof. So here is the international expert. They said they are going to assess 6 cases and give a score between 1 to 5. So they got 5 cases, 5 lipedema cases, and 6 criteria will be assessed. The first criteria, does the large language model, which is LipoGPT, correctly understand the problem? Does it give the correct diagnosis? Does it give the correct recommendation? Does it assess the patient fit for surgery? And this is the problem, remember, number 4, the problem that AI did not perform as well as experienced surgeon. But this is going to change in the near future. Does it present the case properly, satisfactorily? And lastly, does the patient history just been well taken from the patient or not? So these are the 6 criteria that will be assessed by AI and experienced lipidologist. The AI did show out of these 6 cases that he performed very well in all of them, except the suitability for surgery, because we know that this needs a lot of experience. So this is the number 4. They didn't perform well. So when you give a score to LipoGPT compared to the world expert, he scored 4.25 out of 5. And this is great because this program, you can do it in probably 15 minutes. And you can easily do this program and you can implement it in your hospital, in your unit, and you can have the prompting technology. I will give a lecture later on prompting technology in vascular surgery, which I think will play a big role in our future. So this model have very good start. 4.25 is really a good start. So in summary, the impact of AI on lymphedema is huge, and to be summarized in the following slides. Number 1, AI can get early detection of lipedema. We know that from patients with cancer breast. AI can predict which of them will have upper lymphedema. You can have better monitoring to the patient, and you can have a personalized care. So this is the treatment option, particularly for this patient with this scenario. Data sources are freely available. AI algorithm can be advanced by advanced machine learning and deep learning as well, and it can have very good predictor of outcome. It can scan and measure automatically to give you the best compression therapy. It can personalize the compression therapy, and it also can work on demand. Definitely will be advantage to have a mobile application with AI to lipedema, where you can have symptom tracking, remote monitoring, educational resources to educate the patient, and treatment reminder as well to check you need to change your stocking, and you need to measure your lower limb and so on. All these are great advantages that will definitely improve lymphedema care over the very near future. So let me finish by one AI machine that is already in the market using AI in lymphedema cases, and this is Lipo AI, which is a liposuction with an AI program that is dedicated to do liposuction using artificial intelligence. It makes a measurement. There are 3 types of catheters with specifically laser, which is designed using AI, which is a unique technique, the machine called Lipo 360, and with an advanced lipocaster. It will go into fat, measure the fat, know the proper amount of laser to do liposuction and to correct the anomaly. This is already existing machine which already have FDA approval to treat lymphedema cases. And I hope this is a quick summary about the AI in lymphedema, and I hope it will be on benefit. And thank you very much.